Let's ask these questions to Dr. Ashish Jha, Dean of the Brown University School of Public Health. Dr. Jha, all right, good morning to you. Let's start there. So we've got dating apps, we've got lotto tickets, we've got Metro cards, you name it. Is this going to work? Are we at the point where everyone who's gotten that vaccine, who wanted it, is good to go at this point, and you're not going to, there's this last group who may not just get it?
Yeah, so good morning, and thank you for having me here. Look, I think there's still a bunch of people out there who are happy to get it, who may not be thirsty to get it, for whom these kinds of incentives are going to make a big difference. So I think it's great. I mean, again, some of them are kind of funnier than others, but the bottom line is that if this motivates another, let's say, 10 or 20% of adults to get the vaccine, that'll make an enormous difference. And so I'm generally supportive of this kind of stuff. Okay,
I want to ask you about some booster shot questions. There seems to be some disagreements among health experts as to whether and when we're going to need these booster shots. Some say as soon as September. Dr. Fauci says we don't exactly have a date yet. Do you have a sense of when we're going to need booster shots?
Yeah, I have to say, I'm not worried about booster shots anytime soon. I mean, my take is, first of all, Dr. Fauci's totally right. We don't know for sure. I would be very surprised if we need booster shots by September. My mental model, based on all the data that I'm reading, is that at some point next year, many people will need a booster shot. But we're going to determine that by looking at breakthrough infections and what's happening with immunity. I think it's very, very unlikely we're going to need it this year.
So we heard also in Witt's piece there this rage over masks, particularly when it comes to masks in schools. The CDC, we know now, could be on the verge of issuing some clarification, fine-tuning its mask guidelines. Are you worried about the possibility of guideline fatigue at this point?
Yeah, certainly has been some confusion, and of course, states are all implementing these things differently. My general approach on this has been, we know the science on this, which is indoors, if you have unvaccinated people, wearing a mask while infection numbers are high is the right thing to do. And so obviously a lot of younger kids are unvaccinated, and while infection numbers are high, keeping them masked up is the right way to go to protect them. But as infection numbers continue to decline, I do think it'll be possible to get rid of the masks. But we should let state and local conditions drive that and not sort of political fighting.
Dr. Jha, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.